Now imagine a world where mass outbreaks of deadly diseases are commonplace. Well, it sounds scary, but that might not be too far off. The World Health Organization has warned in a BBC interview that we're entering a new phase where such a reality is, quote, a new normal. And it's calling for the world to get ready. Now, it revealed that it's tracking 160 disease events around the globe, and 9 of them have been classified under the WHO's highest emergency level. 2 of them fall within this region, in Myanmar and Bangladesh, where the Rohingya crisis remains unresolved. But a major concern is in the Democratic Republic of Congo, in Africa, which has been grappling with the world's second largest outbreak of Ebola since last August. Over 2,000 cases have been observed so far, and it's proven fatal to more than half of the victims. And that's only the official numbers. The WHO estimates roughly a quarter of infections are either undetected or discovered too late.
And we need to move away from a vicious cycle of where we have late detection of cases, and late detection of cases is still a problem. Community deaths are still a problem. When someone dies in the community, it's a disaster. It's a disaster for the community, but it's a disaster for the response, because that person has been in the community potentially infecting others. So we must get earlier detection of cases. We must have more exhaustive identification of contacts. We need to convince all of those contacts to accept vaccination.
Now, another issue on the WHO's watch list, sexually transmitted diseases. And the figures are alarming, to say the least. The organization found that in 2016, there were over 1 million new cases each day. It says that, on average, around 1 in 25 people globally have at least one STI, like syphilis or gonorrhea. And to make things worse, many are often not aware they're infected, which facilitates the spread of the diseases. The WHO says the figures serve as a wake-up call for the world. It's emphasized the need for comprehensive sex education and for authorities all over to ensure ready access to screening and treatment.